like to welcome on the program now John Park, Chief Strategy Officer with Alegeus. John, good morning.
Good morning.
Hey, John, good to have you on the program again, and nice to talk to you again. It's been a little while.
Yes, it has.
Yeah. John, give our audience a little background on Alegeus for those that might not know Alegeus, which is certainly one of the leaders in this space.
Absolutely. So Alegeus has, by name, is relatively new, however, has been in the marketplace for quite some time, over 20 years, in fact, and really started with the debit card processing that was tied to the early stages of CDH accounts, which was the FSA. Since then, it has transformed and evolved as an organization and really become a complete platform for CDH, incorporating all the different types of accounts and integrating a full suite of real-time single platform that administers and manages all things CDH, including FSAs, HRAs, and HSAs, integrated together with a record-keeping platform, together with a integrated debit card capability. So there's a significant amount of capabilities that we are developing and innovating around, and it really has to do with promoting and moving the agenda around consumerism forward. And we're going to talk a little bit about that through the research that we've done. But more importantly, we have the scale and the size to really be positioned and enable our clients and our customers to do some unique things. So we serve, I think, about 30 million consumers and process over $9 billion of healthcare funds each year.
Yeah, and for those of you who don't know John has been on the very beginning of consumerism back to the Definity days, right, John?
Yeah, sometimes it kind of ages me, but yeah, I've been at this for quite a bit of time. I was one of the co-founders of Definity that really kind of pioneered this space. And in some ways I'm very proud, and in some ways I'm a little bit frustrated at the same time, because although the marketplace has made a lot of improvements and a lot of progress, there's just so much more that we can do. And I see that both as an opportunity and a challenge for all of us as we talk about the improvements to the healthcare system.
Yeah, I absolutely agree. John, you talk about, and I know you want to talk about today, and I think to find this with our market, as we turn to more individual responsibility through consumerism, that there becomes a consumerist healthcare moment of truth. Talk a little bit about that, if you would.
Yeah, absolutely. So I think historically a lot of folks and a lot of people kind of saw the key decision point for an individual in the healthcare system was about picking the right benefit. And as we know, as we've transitioned a lot of the financial responsibility and accountability for healthcare to the individual, that those moments of truth and decision making expand well beyond just the selection of a benefit. So things like, and I heard this earlier in the interview, getting the right most value for the healthcare dollar and selecting a medication through the right channels. Whether it's understanding and making a decision about what procedure or what channel to go through for a specific service. We have more information today as a consumer of healthcare than we ever have before, yet people are still confused and very anxious about making these decisions, and they don't have a lot of confidence. And our research that we'll share in a little bit reflects that. And so we haven't figured out how to make it easy and make it relevant at an individual level to help them make better decisions. And that, to me, is a big missing component. And I think it's also, we're much better than we were, I would say, 10, 15 years ago. Yet there's still a long way to go to really, truly create a consumer in the healthcare space. So when we talk about moments of truth, it expands along the entire life cycle of the healthcare experience as an individual, all the way from plan selection to paying for a service or selecting a service and a provider. So now we're expanding our thinking around what those moments of truth are and understanding the implications of those decision points at a consumer and individual level.
Yeah, because to your point, I mean, it's pretty daunting for a consumer that's never had to make these decisions before, and it can cause a high degree of friction as well, correct?
Oh, absolutely. And in fact, I kind of relate it to certain things. Like in the beginning, when you're first going through this decision-making process, it's very difficult, daunting, and challenging, and can create friction and possibly the wrong decisions as a consumer that you are intending. The system is intending you to make. So, I kind of equate it. Once you go through it once, then after that it becomes easier as a consumer. And some of our research as we look at year over year, we're getting now some trending data that kind of shows that as you go through that process, it becomes easier. So I kind of reflect back on the first time you made an internet purchase. I do remember my personal experience around this. I put my credit card in, I made the payment, and the first thing I did is I called the website, the webmaster, I think it was, and I said, did that transaction go through? Because I didn't trust that the payment went through, or they actually were processing my purchase. But after that, it just becomes second nature, and so you trust the system, you gain more confidence, and it becomes easier. Same thing with healthcare. Some of the things that our research actually shows is that people still don't have a high degree of confidence and still need that human interaction and validation as they become consumers and make some of these decisions. And so one of the things, even with the advancements of technology and the digital channels that are available to individuals, people still want to get that human interaction. And that depends on the various segments, but it applies to across the entire continuum, even to the millennials when it comes to healthcare.
That's great. Ron?
Yeah, John, you've been around for a while as one of the real thought leaders in this whole space, having worked, I assume, with Tony Miller a lot at Definity Health and developing these whole concepts. As you look forward as sort of the thought leader and futurist that you've shown yourself to be, where do you see some of this going, and how are we going to better impact the consumer, especially in the areas where you say they need to develop some trust in the system? We've seen that trust develop in other areas. I mean, how many people take a receipt when they go and pump their gas these days and want to be sure that they get the right bill on their credit card? We don't do that anymore. We have trust in other systems, in the banking system. How do we create that trust and that engagement with the consumer in the healthcare space?
So I think that's a great point, and I think the first element to really building that trust is making it easier. One of the things that our research shows is that one of the biggest challenges in the system is understanding and wading through the jargon of healthcare. It's not easy, it's not simple, and we have to help support the individual, and that to me is, I think, the first step in building that trust. I think the second piece of that is then consistency and making sure that they can rely on the services that they're getting, the payments that they're making, ensuring that all of these programs and all of the things that are available to them, whether it's a financial account or whether it's a program or an incentive or a service that's being provided, is being managed consistently for them as an individual. And then finally, some of the things that I think that we can do as an industry is start pulling together an experience that's actually not fragmented. So if you think about all the folks that are on this call today and talking about weight management programs and disease management programs and the financial and incentives that go along with these wellness programs, making that relevant and simple at an individual level and tying those programs together so that there's relevance and you truly get what we're all looking for, which is true behavior change as a consumer and better health. And ultimately, we believe that those dynamics will drive lower costs for the entire system. And so once you've accomplished that trust, go ahead.
No, that's it. Go ahead, John. Go ahead and finish. I'm sorry.
Well, the last thought I was going to say is I think that's what we're all kind of striving for. Is right. When we talk about consumerism, it goes beyond just a benefit or making a specific decision. It is truly about incorporating consumerism dynamics into the marketplace so that we get those outcomes. And so that can be applied in so many different ways depending on that individual and what segment they fall under.
Yeah, John, we got about 2 minutes to go, and lots to talk about, and love to have you on again. It's always nice, hearing your thought leadership and your views and visions on things. Tell us specifically, if you would, in the last couple minutes, what Alegeus is doing to help support consumers through these decisions, and maybe what's coming next that you guys are working on.
Yeah, so that's a great question. There's a lot of different avenues, different paths that we're taking, a lot of partnerships we formed in the last 12 months, and we continue to expand that idea of partnering with folks that are innovating in best-in-class programs, and that ranges across the entire spectrum of wellness programs, incentives, retail relationships, as well as health-related health management programs like disease management, condition management. Our thought here is that by tying it together with the financial elements, which we have scaled and we've aggregated through our platforms and through our customers, bringing together all of those elements to really drive true engagement. And when we talk about engagement, it's not just did they log into the portal or did they download the mobile app. Are you really able to provide information and decision support tools that help the consumer make better decisions? That engagement engine is something that we're working on together with our partners, tying together the financial aspects as well as the healthcare aspects, and really creating an engagement engine that is useful, that is relevant at the right moment of truth. And so we've got some prototypes that we're developing. We'll be rolling out later this year. And I truly believe if you can demonstrate that simplified experience and tie together the fragmentation of that consumer experience in a way that makes sense, that's going to move the needle significantly when we talk about consumerism. So that's where Alegeus is focused. We're leveraging our expertise and scale on the financial side and working with our partners to bring in the healthcare components.
And anyone listening here can find that information and access to you and others at Alegeus.com, correct?
Yep, that is correct. And welcome the questions and discussion.
John, it's been great having you on the program as always, and look forward to continuing these discussions with you. Good luck at your partner conference coming up in a couple of weeks too, correct? You got your partner conference
next week. Yep, next week in San Antonio.
Next week already.
Yeah.
Have a great event, and love to get you back with our events in the near term. Have a great weekend, and we'll talk to you again real soon.